Hi, in this video we'd like to continue on our PCOS series discussing another form of PCOS classification. So previously we've talked about PCOS and obesity because these patients, they have a complication of having a malformed stomach causing them to be unable to lose weight despite going for the PCOS treatment, the surgery. They still cannot lose weight and they are still struggling to get pregnant. So we do offer at Antai Hospital a comprehensive package. Not only do you need for the surgery for the ovaries, we need to do another gastrectomy on the stomach as well. So another classification for this type of organ malformation relates to the uterus malformation. Up to 50% of PCOS patients have some form of uterine malformations. That is why these patients, despite they're going for PCOS treatment, despite the surgery being a complete success, they still cannot achieve pregnancy. This is because there's another underlying cause that is not being dealt with, which is the uterus as well. There is some problem with the shape and size of the uterus that was not diagnosed and was left untreated. So these patients, although they have recovered from PCOS, they are still miscarrying consecutively. So a full diagnosis is crucial here. Furthermore, these patients are actually born with both conditions congenitally. This PCOS is actually connected with this uterine malformation because, as we've discussed, PCOS is caused by underlying presence of testicular tissue mixed within the ovaries, causing the testosterone secretion, and also all the symptoms that we associate with PCOS. So this is happening during embryogenesis, when you are still in your mother's womb, when you are still developing and growing. Some factors is affecting this process, causing the process to be incomplete, leaving some remaining testicular tissues within the ovaries. At the same time, because of this process being affected, the process of the uterine formation process also can be affected at the same time, which is why these patients are actually born together with PCOS and also some form of uterine malformation. This is a congenital condition. You do not develop this after you are born. So the most common form that we observe is that PCOS and a presence of some form of uterine malformation. The most common one is being a septate uterus, and the second common one is a naive uterus, both of which can be effectively treated at Antai Hospital. So for these types of patients, full diagnosis is a must. And once we diagnose both PCOS and the uterine malformation that you have, all you need to do is a surgical correction for the uterus and also surgery for the ovaries at Antai Hospital. So surgery for the ovaries is that we will use laparoscopic surgery to remove these tissues, and afterwards we need to go for a hysteroscopic surgery to correct the uterus shape and size. At Antai Hospital, for the uterine correction surgery, we use a cold knife conization because this will minimize almost no scarring and also no formation of any adhesions as well. So this can actually promote healing, and furthermore we can also administer our in-house proprietary invention, which is the intrauterine stent, to actually maintain the uterus shape and size. And once the endometrium is fully recovered in the presence of our bioadhesion barrier as well, then we can remove the stent, and within a few months you can fully recover and you can go for conceiving. And this time you will actually see full success and no complication whatsoever. And success rate is quite high, up to 95% as well. So this treatment is offered to anyone who's interested, especially those who have gone for PCOS treatment and have not seen surgery, because there is another underlying treatment that needs treated, which is most commonly some form of uterine malformation. So get in touch via the website and also leave me some comment down below.